Hello, everyone. It's Apollos Pedro here, and you're welcome back. It's an honor for me to be with you again today. And like I promised the other time, to be able to come over here with great guests to meet your demands and the questions and everything that you guys keep continue to ask us on Pedro Podcast. I am happy to announce to you tonight that I have in the studio with us Dr. Manuela Sberna, a psychologist by profession. And if it is important for those that may want to know, an Italian Australian that has worked over the years with a lot of people in the diaspora, refugees, and children across the world, here in Italy, in Australia, and other parts of the world. So for me, it is an honor, and today we'll be discussing about adversity and when tragic event has happened, how we can manage to deal with them. It's an honor for me tonight to welcome Dr. Manuela Sberna. Most welcome, madam.
Thank you, Pedro. It's an
It's a
honor to be
pleasure.
here. Thank you for the invitation.
I should be the one thanking you, actually, because myself and my followers will continue to use this platform to be able to meet the need of people that may not have that possibility to go to a professional. Although we advise that whoever is listening to us, they should not take this advice. Oftentimes, especially except from someone like you that is certified to be able to do something like this, they should always go for professional advice if the need is there. But however, our mission with this podcast is to be able to help people. So that's the reason why we talk about society, child upbringing, interpersonal relationship, immigration system. Profession, I'm an immigration expert, and I was lucky enough last year to have undergone a training for PM Plus training. In other words, I'm able to assist people too, going through some difficult times by the professional training, and you were one of my professors as well. And this is what we do with Pedro Podcast, and I believe it's a platform that has a purpose and it is very useful for our followers. So for you to be here with us tonight, it's indeed an honor for me. Without further ado, Doctor, who is Manuela Sberna? And I hope I didn't destroy your name. Actually, did I pronounce it correctly?
Manuela Sberna, that's right. That's right. It's a difficult name, even for Italian people.
Can you imagine? So I'm not the worst out there.
Yeah, so I'm Italian, so with an Italian citizenship, and I became Australian after moving to Australia.
Okay.
So I don't have any Australian ancestry, but I'm Italian, and I grew up in Italy and studied here. I studied psychology in Milan, and then during my studies, I did travel a little bit, and I spent some time in Thailand, and I started working with refugees in Thailand, first time, actually, and I was around 23, 24. And that was my first experience with refugees that were arriving in Bangkok. Yes, and starting to be interested in that group, the needs of that group and what they were bringing, and just the complexity that they were bringing, and the fact that there were so many different cultures. And I'm always been interested in cultures. And then I moved to Australia, and after a couple of different work experiences, I moved back into the refugee services
sector.
Yes. So I worked a little bit as psychosocial worker, and then moved into clinical work overall about, let's say, 7-8 years. Yeah, so that pretty much has become my main area of focus. Then I moved back to Italy a few years, came back in 2021, end of 2021, and
just after the pandemic. No.
Yes, exactly.
During the pandemic, actually.
Well, yeah, it was towards the end of the pandemic, 2021. And just speaking about adversity, just also trying to reunite with the family after,
Yeah.
all the difficulties in traveling. So it was a good opportunity to come back. And so here I am for the next month, because then I'll be moving back to Australia in October. So
Just crazy. That's
yes,
that's unbelievable. That's unbelievable.
just I can't help
That's
it.
unbelievable. Of course, of course. Yeah,
Yeah.
you have a calling, and I'm happy that you're able to work for the human race. Working in this particular sector is something that I believe that one has to have a calling to be able to work in this
Mm,
particular
mm,
sector, because
mm,
you actually meet people going through difficulties in their life. And
yeah,
being able to help is something that is very, very interesting and important for them. And I happen to
yeah,
know during the course of my studies as well that at times you study not only because you like the glory that come with that particular profession, but for the fact that you want to be able to help your fellow humans. That was
mm,
what my psychology professor told me at the university back in the
mm,
days.
mm,
And in the course of my career, I have happened to realize and come across situations that add meaning to that concept or idea that she shared with me in the aspect of being able to help other fellow human beings, working in
mm.
the migration sector
Yeah.
officially as a person.
It's very strong. It's a very strong experience. Some people will move out very quickly from the sector,
Yes.
because you kind of have to deal with lot of different factors and difficulties in supporting people sometimes, or see the positive, or see the the good ending.
Mm.
There's so many challenges all the time, and there's a political pressure,
Yes.
and it's hard to cope with that as well. So beside the needs and the vulnerability of the people, but also just the context, political context that you deal with, it can be really, it's just not a nice thing to feel when you see
Yeah.
the suffering. Yeah, so
That's true.
it's hard.
That's
And
true.
I think personally I did go through that phase where it was really hard to deal with that,
No,
but eventually kept going.
things work out perfectly.
Yes.
Perfectly. And that's the reason why we are here today. That is what we want to talk about, really, because a lot of my followers have filled me this question. And without further ado, I would like to ask, going into the topic of our discussion today. For the fact that in the course of your profession, you have met a lot of people that have gone through difficult times in
Mm,
their
mm, mm,
life. What exactly can we get to define and accept or understand to be an adversity?
mm, mm, mm.
What what I mean is, how should my life be? What should that thing that I would have observed over a period of time to be able to tell myself that I'm actually going through
Going
an
through an
adversity?
adversity. Yeah, I know. It's a bit of a vague concept, I find, because I think adversity, is defined as a difficulty, like a challenge that
Mhm.
people go through and is affecting them, is causing distress.
Okay.
Sometimes is defined as a misfortune, so like that bad luck, like a bad
Mhm.
event that just happened out of bad luck. So in that sense, takes away a lot of the individual's agency in that sense. But then there are other types of events, such as interpersonal, conflict, or interpersonal, or emotional pain coming from in
Okay.
relationships,
Mhm.
that I'm actually not sure whether they will fall into the adversity definition or not, or which category will be into that definition.
Mm.
Probably domestic violence, abuse, I guess, this kind of interpersonal contexts that are really severely affecting the person, in that sense, that are really damaging and traumatizing, there will be adversity. Other more regular interaction that can be challenging, I'm actually not sure if they are defined adversity or not.
Optimal.
Yeah. So,
That's
and
very,
there's
very
also, I mean, there's also very different types of adversity, in a sense that even, working with migrants and working with people that have a regular life, locals, you can see there's adversities in both ways. But for example, with migration, the adversities can actually affect the whole community, all sense of safety. So that's the extension of the impact of adversities is much wider, and it affects much more areas of life than maybe a car accident.
okay.
So yeah, I can see this. It's such a wide, it's such a broad range of events that can be considered adversity. What I can see that is that it's probably mostly something that comes from the outside
Okay.
upon the person, and that the person needs to cope with and endure.
That probably lead,
Yeah.
like you said earlier on, to the personal agency of the particular person
Yes.
in
Yes.
question. Okay. That's so interesting. It's so interesting to know because, especially when one is fighting a battle in life, there is this general saying from where I am coming from my society, that
Mm.
life is a battle. I believe it's a universal saying anyway, but just to be correct for the sake of being correct in our discussion, that's the reason why I'm pinpointing it from the society that I came from. It is usually
Mm.
saying that life is a battle. And I think that's the reason why, in all fairness, this question was really, really important. If indeed life itself is a battle, then
Mm-hmm.
when can I, for one, know when I'm going through an adversity, and how can I seek for help if that has been established? How
Mm-mm-mm-mm.
does it have to go for a long period of time or a short period of time? Doctor, you said
I
oftentimes it's
think it
something that
doesn't
comes from
have
the
to.
outside.
Yeah, exactly. And well, it could be a car accident that isn't having a long-term impact. That's an
Like,
adversity.
yeah,
Or it could be the death of someone. So it's a very short event, but it has a big impact. Or it can be an illness or disability which lasts for a long time. So I don't think the length of time can be a criteria, but
okay,
probably more the impact it could have on the person.
that's so fine. Definition is very, very important. I'm sorry that it might look rhetorical, sound rhetorical for those that might be listening to us, but I really want to be able to get this clear, even for my listeners as well. Even though it might sound
Mm.
rhetorical, but if one is able to have a clear, with just this example that you gave, an car accident, for instance, may have destabilized the life of the subject that was
Yes.
involved in that particular accident. At the same time, it may have extended to the family members as well.
Yeah,
Somebody
exactly.
had to take care of the person that was involved in the accident. Probably the person that was involved in the accident may not be able to walk again, both
Yeah,
economic
absolutely.
and emotional. So it could be something, an
Mm,
adversity in other
mm,
words,
mm.
could be a thing that have a compound effect on those around them.
Yeah, absolutely.
Will I be correct?
It's it's a bit like the concept of trauma, in a sense.
Hmm.
There's
Okay.
some events that are potentially traumatic for most people,
Mm.
and then some other events that they could be traumatic for some people, but not for others. For example, getting stuck in an elevator for some
Yeah.
people would just be an unpleasant event, and for other people could be really stressful.
Yes.
So I guess there's some level of adversity, some types of adversities that are a little bit borderline.
Mm-hmm.
For some people would not imply such a, massive effect, and for other people would. Why other adversities are just more, across the board, quite challenging. Yeah.
That's so interesting. Thank you so very much. And in line with what we are talking about here, uh, just to extend it, to kind of expand it a little bit to areas that I am thinking. I am wondering for parents that have a disabled child, that they are
Mm-hmm.
going to take care of that child for a very long period of time, maybe the entire life of the person, because
Mm-hmm.
there is various category of disability, various form of disability.
Mm.
Mm. That could be an adversity, I believe,
Absolutely, yes.
because that's
Yes.
something that will change both the personal relationship of the couples
Absolutely.
and
Yeah.
even the economic status of the family.
Yeah, no, absolutely. Disability could be an adversity. It's a challenging event. It's impacting a lot on the persons.
And
And
those
it's,
around them.
yeah, it's a lot of different implications. Yeah.
Doctor, will it be true then if, for instance, one is doing what they believe they should be doing? Let me make you a very practical example. I have
Mm-hmm.
gone through, I've gone through the educational system. I've been to school to the university level, and I
Mm-hmm.
grew up knowing that you go to school, get a job, build your life, and you'll be okay. That I
Mm-hmm.
have, and that I have justly done. I mean, I've done that without problem. But I've been working on my life. I even do have a job. It's not enough for me to take care of myself. Practically, things are not working out for me. I'm doing the best that I
Mm-hmm.
can, but it seems that the more I try, the more things continue to go the opposite way of what I expected it to be.
Mm-hmm.
If I
Mm-hmm.
happen to be in that kind of situation, one, can I describe, am I permitted to describe that to be a form of adversity? Or how do I describe that situation and what should one do in that kind of situation?
Mm-hmm. So you're asking if you could define that an adversity, or what you can
Yes,
do
can
to
I?
deal with that situation?
Yeah, those
Both.
are the two airports. Yeah,
Okay.
because
So,
the reason why I'm asking doctor is this. In this on this podcast, I have a lot of people that are living in the diaspora that do
mm,
listen to my podcast. And some of us, even partly due to my personal experience, moving from one country to the other,
mhm,
having to start afresh, like as if I'm a little child, and having to go through life again. And at times, things do not work out easily.
mm, mm,
This is
mm,
just one example. For another person, it might be their marriage, it might be a long term relationship with a significant other, where one put everything on the table,
mm, mm,
give
mm.
have given their best and everything, but things just seems not to be working.
Just not what. Okay, so it's a tricky question in the sense that it's always that dynamic of looking at outside or inside.
Mhm.
So if you're describing a situation that's related to, for example, migration, having to start all over again, a different country. So there's a lot of external factors that are contributing to the difficulty in finding a job and supporting yourself financially. So that then
Yes.
we're looking at an adversity that's going on. In other cases, it could be a consequence of the individual not having the right attitude or not making the
Okay.
right choices and persisting in making wrong choices. It could be the case of someone who tends to be aggressive and so keeps losing jobs, even if maybe there are opportunities, but they keep not engaging very well with people and putting themselves into difficult situations. So there's two different things. So if we thinking about the adversity,
Mhm.
um, And I think your question was also about what to do if I keep trying my
Yeah,
best and there's so many issues going on and I can't just get what I want, and I can't obtain whatever job I want.
yeah,
I can't support myself. Okay, so I think that it's important to review
okay,
your the goals and the expectations and see if I'm actually trying to achieve something that is not possible
okay,
first. So I think that's important to reevaluate that and see what I'm trying to do. Is it actually possible? Or there's so many things that are preventing that from happening, and I need to review my goals or the things that I can work on right now. So I think that's the first step. And the second step would be, once I have some adequate goals, what is what is in my power to change and contribute, and what is not. So that's helpful in a sense that sometimes people will waste a lot of energy
okay.
to try to pursue whatever. And so whatever is changeable, whatever it is not, and that's exhausting. So just having the clarity and see, okay, this part of my life I can do something about. So let's see what I can do. And this other part is mostly out of my control. So I'm just gonna
Mhm.
have to deal with it, learn to tolerate that distress, learn to manage in a way that is affecting me the least. So it's not, I know it's much easier to say than do, but
Yeah,
that is pretty much how it is. And I understand that sometimes life can be very difficult, and that can be challenging for people that have gone through a lot and they feel maybe
yes,
exhausted.
that's
Yeah,
true.
yeah.
Thank you so very much. I mean, you said something that is very, very powerful in the sense that we
Mm, mm,
should,
mm,
at times, despite the circumstances in which we find ourselves, before we begin
mm,
to make that judgment that things are not going the way it should be, if those things
mm,
that we want to achieve are actually something that is achievable
mm, mm,
based on the state in which we find ourselves at that time. This, I think, most of us are not doing. I
mm,
think
mm, mm,
this, listening to you, I genuinely believe that this could be very, very hard for very many of us to do.
mm, mm, mm.
You have to have been living in that elevated state of mind to be able to make that calculation or to have arrived at that understanding to
Yeah,
ask that
yeah.
question. I doubt, even though I do not know for a fact, but I doubt if a lot of people will get to that place that they ask themselves the question.
Mm,
Because
mm,
that's
mm,
what I mean, being with the type of job that you do, and you have, we both live in the modern time. We live in an era of victimhood where everybody wants to be the best or worst victim of whatever situation that they find themselves. This is not to discredit those that are actually going through a difficult time, but there is also that aspect of the kind of personality that most of us have acquired today, being a victim of whatever circumstances around us, passively blame to other people. Meanwhile,
mm,
one could actually be in a situation whereby things are not working and they might be having this difficulty. And I hope that
mm,
our
mm,
listeners
mm,
they take this point into consideration.
mm,
And
mm,
like I keep saying, if you need a professional help, please do. Although there are
mm,
practical steps that you can take, some
mm,
issues cannot be
mm,
discussed just in the podcast. Those help are
yeah.
really necessary. But mind you, if you are going through life thinking that maybe things are not working the way you expect them to be, sitting down and taking a stop just the way doctor has said it is very, very
Mm, mm,
important.
mm, mm.
I really appreciate that explanation.
I wanted to add something, and I think
Okay.
I'm not sure if you mentioned that in the question, but it was a part of the question that you were mentioning about doubting yourself. So what to do if you doubt yourself? And I find
Yes.
that doubting yourself, it doesn't have to be a bad thing.
Okay.
It could be a time where you feel like, okay, something is not quite right. So let's have a look. Let's see what's going on, really, with that curious attitude, open attitude to see what's happening that is within me or outside of me that is just not working well. So in that sense, it doesn't have to be a negative thing. It becomes a negative thing if it becomes critical and self-blaming, that kind of doubting yourself and putting yourself down. Then it's a negative thing. But if you use the right approach, it can just be a time where you feel and you admit to yourself this is something is not quite right. Maybe even admitting that I'm really not coping very well right now. So maybe I need some support, or I need to change something at this point without having to feel inadequate, without having to feel ashamed, because that's just a natural, normal experience of humans.
Right. Right. It's so true. I have a friend that believe that she has never been able to choose a mate, a partner, all her life. She has always gone out with men. In her opinion, this is her real life experience that she has only gone out with the type of men that she shouldn't have gone out with. She despite the fact that she's educated, she's everything a woman, quote unquote, could be, but she has never been able to choose a mate all her life. All the mates that she has chosen has always been something or the kind of people that she shouldn't have been with. So she felt really, really bad concerning this. And
Mm.
I didn't know what to say or do in that kind of situation in the sense that these are people that she chose. And I don't believe that she made a mistake choosing her mate. But what confuses me was why that problem should be, why should that blame be put on her mate? But listening to you right now, like sitting down to take a stock and know if this is possible or not. I don't know how well it relates to this, but in her opinion, that could be a situation in her mind, in her way of life, that is a problem. Because over and over again,
Mm.
she has done her best, but things seem to be working out in that direction. Can that also be described as an adversity?
Well, if
If
it's
one
more,
really feel pain, and she sees that as a problem, honestly.
I feel it's more of an internal struggle than an adversity.
You know,
I find that adversity is more, yeah, kind of an external thing. It's more of her own struggle to accept
mhm,
something. Yeah, because adversities are mostly difficult
mhm,
situations. It could be poverty, unemployment, things that would be challenging for most people.
mhm.
Then some people will react in different ways, but they tend to be difficult challenges.
So
Mm-mm-mm.
true. And that distinction is very, very important. Distinction is very, very important. I'm so happy about that.
Yeah.
And if if I may ask Doctor, could it be true then that it is the way that we interpret things that determine our level of suffering in this kind of situation? Yes, a tragic event may have happened, like an accident, a loss of loved one,
Mm, mm,
unexpectedly, our means of livelihood may have gone away. But going back to the example that you made earlier on, you made example with someone being in an elevator, being stuck in an elevator, probably the person is not
mm,
worried. It's just one of those things that happen in life and the person is fine. But for someone else might be a very traumatizing experience being stuck in
mm.
an elevator. Based on that analogy, will it be correct then that it is our interpretation at times in life that kind of make the suffer that we go through something unbearable for us?
Yeah, absolutely. It's a huge thing in a sense that you can have people, and especially I think I learned this working with different people, going through different challenges, and then you see the different reactions. And honestly, you do learn a lot. You do learn a lot for yourself as well, because certain things maybe I haven't gone through, or I've gone through maybe these little things compared to other people. And then I
Yes.
remember some people, how they've been strong and how they've been able to manage just by using that kind of attitude and perspective that was more helpful than that of other people that were maybe more negative and just falling into hopelessness. So when there's hope and there's something that is supporting a sense that something good could happen, that's very powerful. I find in all circumstances. So you could see very different reactions from people, even in terms of tolerance. In terms of acceptance. Some people very religious. They would accept certain things that happened as as God will, and because of their faith, they will just find reason, find a meaning to what's been happening through their faith, and just that it can be very helpful. While other people can be left really confused and confused about the world, about themselves, and what has been happening to me, and that it's a kind of a risk factor in a sense. So this is just an example. Of course, I'm not saying that only religious people will go through events in a positive way. That was just an example to say, and the way that people think and interpret events, how it can change. And on the other side, I just wanted to mention, and this is not, it was not an adversity, but I do remember there was a girl. There was nothing with the refugee sector at all. It was just a girl who actually ended her own life because she thought she was going to fail at school. Okay, so this just to say the perception of this girl, of what it meant for her to fail at school, and what it meant for the family to know that. And I don't know what she was thinking, but for her that was like so tragic that she could not cope with that failure. So this to say, how much interpretation can change the way we feel.
Our life.
Yeah, absolutely. Yeah.
How can our upbringing help us in this direction?
Sorry?
Because is there anything that parents can do when it comes to this, our interpretation of the world? I am just thinking, looking at, based on the example that you just gave, I am wondering what could have been going on in that little girl's house. Why does she believe that the most important thing in life is passing exam? Of course, by all means, you should be able to pass the exam, study hard and everything. But if you fail today, you do it again next time. I am not saying this to underestimate her perception and everything, but I am trying to understand the environment in which she grew up and what could her parents have done better.
Well, I mean, it's a bit complicated, maybe to take that as an example for this, because we don't want to assume that the parents were somehow making her feel like
Negligent. Okay.
So we don't know that. It could be that the girl, a teenager girl, it's usually a very complex time of parenting. There's a lot of conflict. There could be some division, and the girl could have gone through depression at that time and just reacted the way. So we can't really imply that, but just generally speaking,
Yes,
certainly, yes, the way, let's say, how to, support our children to be resilient in front of challenges. We can do that by teaching them to tolerate distress and kind of guiding them making the right choices or finding, their own values, the values that are guiding for them to make the right choices. From one side, I say guide because we don't want to do everything for our children, and nowadays it's like
absolutely.
some parents that are like super protective and they just do everything and even more.
Helicopter parenting.
Exactly. So
Mhm.
it's good for the children to experience some stress sometimes, as long as it's something that is not unbearable. It's
Yes.
okay. So that's one other point, that if we are distressed because our children are facing stressful situation, it's
Hmm.
not helping that much. So we need to step back and let the child deal with some level of stress and support when is required to help them cope and contain their distress and their emotional suffering. Okay, but we can't take away the stress from children. It's not helpful. They need to be dealing with the right level of distress. Of course, we're not talking about excessive distress because that would be damaging.
Hmm.
So it has to be something that is bearable.
Absolutely.
So I don't know if I answer your question, or if there was some other aspects of this that you wanted to.
No, 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 no. It is clear. It is clear. I asked the question
Mhm.
based on, unfortunately, the way my brain works this time around, because I live in a society or a time whereby parents oftentimes are blamed for everything. So
Mm,
when you gave that example, my mind went straight to maybe parental negligence, or or a lazy parent that doesn't build structures around their children and everything. But I was wrong, because, like you rightly said, Doctor, the parents might have done everything, but that may have been a problem that little girl personally is going through, aside of what her parents might have done or not. I didn't see it
absolutely.
that way immediately. That is
Yeah, no,
unfortunately.
there's no perfection, and of course, no one can be blamed for someone else taking that
Yeah,
choice. It's such a big thing.
absolutely.
So
Mhm.
absolutely not. It's really hard to be parents anyway,
Yes,
especially nowadays because there's so many.
absolutely.
So the system
Absolutely.
the system of values, I think, is just not as defined in our society, with all these changes and different cultures and modernization and the role of certain framework of values that are becoming a little bit weaker. So it's
Yes.
not easy to guide without even clashing with, the group of peers, the society, the modern society. Is not easy. So it takes a lot of flexibility and open communication and adaptation to be able to keep connected with the children and be there
That's
for
true.
them.
You're right. Especially based on this you have just said. Do you think that parents today are doing the right thing when it comes to their children? Even when you made mention of children experiencing the right amount of stretch to enable them grow,
Mm.
probably being an upright citizen in the society. I use the word upright, quote and unquote. I know that might be triggering to some people, but the thing is that, are parents doing the best that they can to
Mm.
even
Mm.
help their children? overcome some of those things, because you rightly said that and the right amount of stress is needed for children to be able to function well.
Mm-hmm. Mm-hmm.
In your experience, both home and abroad, do you see our parents today doing that? Because I do believe we live in an era of everything for my children. The happiness of my children is the number one priority and everything. And me, I for one, I'm guilty of this as well, because parent too. So are we doing this as parents in your experience?
Probably a bit less than before, because it just the parents tend to be a bit more involved in the children's life. Just for example, with school, and it's also a system thing. It's a system generated thing, I find, because nowadays, for example, parents need to be really much involved at school and supporting with homework. Sometimes it's really challenging for the children. Maybe years ago, the school was not that demanding, and the children were just left to do their own things, and there was so much pressure in performing and doing well. So it's many things have changed, and sometimes I find the parents, they also find themselves in those positions even if they don't want to. So it's a different factors that can influence that. So we need to be extra careful.
That's so true. And talking about happiness and adversity or a tragic event, I would still like to know your perspective concerning this. Should parents be friends to their children? Because this is something, even among my friends, I have had a discussion before.
Yes.
And my very good friend and co-host, Tiasha Kasteleka Somali, said that no, I am not friends with my children. I am their parents.
Yeah.
Which is the best approach, especially considering the example that you have raised? And it is our duty as parents to be able, at least to give our children some structure. We are not talking of abuse here. But looking at the situation in Western world today, can that form of parenting ever be accepted again?
Well, I think okay. Generally speaking, of course, we need to keep boundaries. We can't just act as friend only. So we need to keep boundaries in a way that we can play the role of parents. And that's the kind of relationship. But then different people have kind of different styles. So some people, they become more friendly, or they may be a bit more permissive, and other people, they tend to be a bit more rigid. And I think it's also a personality thing, which is okay. There is this interesting model, which actually is actually from based on the attachment theory, and it's been used across cultures, that first of all points out how it's important to be good enough parents and not perfect parents. So the good enough, it's good, it's enough for the children to grow well. And it points out the two sides of being strong, wise, being strong and wise. So that's the thing. So you do still want to be the one that's there to contain and protect your children and guide your children. So you do give some structure, you give some rules, but you also show some warmth and some empathy. And as long as there's boundaries in that relationship, and that's clear that you're not friend, even if you're friendly, and maybe sometimes you act like a friend and you're close to your children and they share things with you, and that's great. But the boundaries are still there. You're still acting as a parent. It's a bit like when you have those double roles, those double roles we talked about in our collaborations, like, having one role and another role with a different person, with different functions, how difficult it is. But if you can manage, if you know exactly where your boundaries are, then it's clear, and that's no
You
issue
know,
with that.
thank you so very much. And I like the fact that you said parents, we should be good enough and not be perfect. I'm like, wow, this is interesting. So one, it's difficult to be parents. At the same time, you are not supposed to be perfect. It's the only area in your life you are allowed to be mediocre. Don't be perfect, just be good enough. Is that not
Yes,
crazy?
yes,
That's
yes,
that's
absolutely.
that's so
That
interesting. Be good
yes,
enough, don't be
good
perfect.
enough. Good enough is good. It's healthy. Good
Absolutely.
enough is healthy. Perfect is impossible, possibly unhealthy, because you will be one extreme or another. So it's okay to make mistakes sometimes in parenting and in relationships. I guess in general, we're not machines and we're not perfect.
And you know, in line with our topic, to be very honest, this is something that is very interesting because we live in a moment. I believe you may have come across it or heard about children that grew up, adult children, for instance, or people that are no longer in talking terms with their parents. Because, like I said, I'm surprised that you said parents, you should be good enough and not be perfect. But oftentimes we as children expect our parents to be our hero, be perfect, superman, superwoman, and everything. And most of
Mm,
these things we do not know. We take their love and discipline to mean punishment when in real sense they mean when false. I am not saying by any means that parents could be perfect. Of course, that's the reason why some children have issues with them. So they no longer talk with their parents because of what may have happened 10, 15 years ago. Probably the father wasn't the best, quote unquote, that they would have, the way they would have wanted it, but the mother wasn't there, was always at work, and a lot of things that today we now consider and use as parameters to judge if a parent was good. Probably 10, 14, 50 years ago wasn't that way. So
mm,
in this kind of instances, is it possible? Is there a place for forgiveness for oneself
mm,
and even for those that may have wronged us? Why am I asking this? Some people, I believe, may have been in a prolonged form of bitterness that they themselves may have defined as an adversity, as a
mm,
long-term tragic
mm,
effect or trauma that they are going through. But I'm happy
mm,
today that you were able to make it clear on a surface level the things that we can at least describe as being adversity and some other things that could simply be trauma or the way that has to do with our personality and the way
mm,
we process things. So if a person have this kind of bitter relationship with their parents and no longer talk to them, they are no longer in good terms, but they
mm,
themselves personally are going through pains and agony because of this non-existent relationship between them and their parents anymore.
mm, mm.
Can forgiveness be helpful in this kind of circumstances? Is there a place for forgiveness when one is dealing with an adversity?
Well, is there a place? I mean, it depends on the person. If there is a place, in the sense that, of course, forgiveness is possibly a way to move forward and just don't get stuck in rage and hatred towards someone else. But it's also not something that you can just decide to have and not have. I mean, you can also say that, but it's hard to feel that, right? You can say, okay, I'm going to forgive because I don't know, my father was an alcohol addict and he didn't know what he was doing. And
Good.
that's why we end up fighting and he hit me or whatever. So you can say that, but the actual forgiveness is when you feel it, that you don't have hatred towards him anymore. And that's not that easy. It's definitely a healthy thing, but sometimes it requires more efforts and more work. Depends on different people,
Yeah.
react in different ways, and it's not easy to just tell someone you should forgive him. It's not that, it doesn't work that way. It's hard. So some people need to actually go through work themselves, like an internal work, where that part that is being hurt can be soothed and can be validated. And then at the end of that sort of process, they might conceive forgiving the person that hurt them. But because there has been some kind of relieving of the pain, some kind of witnessing of the pain.
Mhm.
So this is what psychotherapy is meant to be doing when someone is stuck with pain that's just not resolved and is affecting the person. So yeah, it's beautiful, and this is definitely an option, but sometimes not easy to achieve that. Absolutely, yeah.
Wow. Wow. That's so
Mm,
interesting. That's so interesting because I heard about forgiveness in our social cycle, that for you to move on, you have to forgive and everything. And I'm wondering if a tragedy has happened, because on
mm,
average, especially I work with young people, and what they consider to be tragedy at times could be their internal relationship among their family. Not
mm.
that it is a practical violence, but probably they can
Yeah,
see eye to eye within between themselves, and
absolutely. Even
so
emotional pain can be really damaging. Yeah, long term.
so good.
Mm,
So that's the reason why I felt that I should bring it to your attention tonight, so
mm,
that
mm, mm, mm.
can be able to reason
You
together with
know,
it.
there is an approach, a therapy approach that is based on compassion of
Compassion.
oneself and others.
Okay.
Um, and um, and one of the exercises is meant to be fostering your
Okay.
internal part that is the most compassionate. It's like all of us have this internal compassionate part. For example, when someone is in pain and we support a
Mhm.
friend, we do activate that compassion side, and sometimes we do with ourselves as well. So it's like this approach where you want to reinforce that, and you can think about an image or a person or a celebrity or a character of a book or a movie as well, if you want to imagine that, that embraces the main characteristics of a compassionate person, like someone who's wise and who is warmth and that empathize and that's had a lot of wisdom and strength. Someone that's maybe you know someone like that, maybe you imagine someone like that and try to think about how this person will react to.
Act in that situation.
So
Wow.
it's just I'm just giving you just a glimpse of that, but that's something that can be helpful to develop that compassionate self.
Um, okay. That's interesting. I'm so happy to know that. Very, very interesting. And I'll be very glad to pass it around. And then if you, to those of you watching us tonight, I hope that you are writing and taking those things down. And if you find this video very interesting and useful to you, please pass it around, share it so that it will get to other people as well, that they might
Mm.
be able to use some of these instruments, this knowledge and wisdom that Dr. Manuela Sberna is sharing with us tonight. Thank you so very much, Doctor. I'm really grateful. Stay on the issue of adversity. Now that we know what adversity is all about and the various form of things that we can, traumatic experiences that we can describe, or qualified to be adversity. Other than the things you said already, because you said one of the examples that you gave earlier on while describing if situations were that we should endeavor to know if what we are doing is actually something that we can be able to do as at that particular time.
Mm-hmm.
Let's say, for instance, a particular tragic event happened in one's life. Maybe the loss of loved one, maybe the loss in an abrupt end to a person's career. Unexpectedly, maybe there was a takeover from one company to the other in their place of work, and they were retrenched and was not part of the new team going forward. And this is a career or a job that has been part of life for that person. Are there other practical ways with which we can go or move on when a tragic event has happened?
Yeah. So it's I think it's a very important point because we all go through this, in a way or another. It always happens. So, and probably all of us, since we are not as young anymore, we probably all went through very painful experiences anyway.
Absolutely.
So, so the thing I think that I learned, probably, let's say, personal experience and a bit through my work, is that definitely we do tend to escape from pain. So as much as possible, something happens, we feel hurt, and we just want to remove the pain. So maybe we will just distract ourselves, and sometimes it is helpful. But I find that that the part of pain that needs to have a space. Talking about space, going back to the space. So we need to let the pain be for some time. We can't just eliminate the pain, and I think we need to start thinking that the pain is not a bad thing. It's a difficult part of life, but it's something that it's a signal that something important has happened. And so we need to kind of also be able to stay with the pain. The pain is going to go, it's not going to be forever, and we're going to do whatever we can do to soothe ourselves and just take care of ourselves in any way possible. We don't have to not think about it the whole time. So we can leave some space to it while we're doing things for self-care, and while we wait for our natural, the brain is, and our mind, they just have natural mechanism to recover. So things will just will just happen. It's like when you get cut, your body does the work, okay? The skin will recover. It just needs time. Sometimes they get infected, and so you give a bit of extra help and you get some extra medications to help. So that's what we can do. We can facilitate the healing, but we need to allow time and to be tolerant of the fact that we're going to have a wound that's going to heal with time. Yeah, that's my best possible suggestion that I could give.
Thank you so much. Thank you so much, Doctor. I'm so grateful. I'm so very, very grateful for the information that you shared with us tonight. And before I will let you go, for those that may want to get in contact with you, how will they find you?
How do we find me? Okay.
Yeah.
Well, I do have, I'm an Australian platform,
Okay.
which is, or maybe I can, it's called Talked. It's called talked.com.au.
Okay.
Okay.
Talk.com.au. Okay.
Yes. So they can also send me messages if they have a question. or they can book a 15 minutes free chat if they want to talk to me for 15 minutes.